It's the middle of the night. You're jolted awake by your child's warm forehead and their flushed cheeks. Your heart starts to race as you scramble for the thermometer, you take their temp, and you confirm what you already knew. Your child has a fever. Like most parents, your instinct might be to immediately reach for the fever reducing medication. But what if everything you've been taught about fevers is actually incomplete or even incorrect? Did you know that fever reducing medications might actually make your child's illness last longer? Elevated temperature actually isn't an enemy to be fought, but it's an intelligent healing response. It's orchestrated by your child's brain and their nervous system to actively fight infection, to activate and supercharge the rest of their immune system. So it's doing a very important job. So, in this video, I want to help you completely reframe how you understand fevers and give you the confidence and the knowledge to support your child's natural healing abilities rather than just suppressing them. Because knowing how to handle a fever is something many parents often wrestle with. On one hand, we have the traditional pediatrician and medical view, which says, fever reducing meds, antibiotics, lots of medications, those things aren't a big deal. But on the other hand, our parental gut, our instincts, and our even common sense tell us that, well, it's pretty normal for kids to get sick, maybe have a fever here and there. Maybe we should just help support the body heal naturally versus short circuiting the work it's trying to do. So ultimately, how we handle fevers really does play a role in whether our children develop strong, robust, and healthy immune systems, or unfortunately go down the road that's all too common today with a suppressed, dysfunction, weakened immune system that happens over time. So I want to dive into the role the fevers play in actually helping fighting off illness and helping your child develop a strong immune system over time. I'll also share in this video strategies you can do to understand if your child does have a fever, is it in the danger zone or not, and what you can do to help your child get through things naturally. So I do want to go over, before we dive in here, what a fever does and where it falls into play. So on this chart here, you can see it's titled The Cycle of a Healthy Immune Response. So when we're exposed to bugs, a virus, a bacteria, it first is going to go into what's this called this prodromal period. Basically, this means it's starting to replicate and multiply, but we don't quite know why yet. Next, a chill comes into play. The chill is there for a very important reason because it's this part of our brain called the hypothalamus that's acting as our body's thermostat. So, what's happening is our immune system is detecting a virus or a bacteria and it's saying we need to do something about this. So, the hypothalamus changes the thermostat. If your child's thermostat, let's say, is 98.7, 98.6 is the average. Not everyone is there, right? As you know. So now, if we say we need to get a fever to 101, if our thermostat suddenly is set for 101, but our actual temp is 98.7, we feel cold. So we start to shiver and we start to shake and we start to raise our body temperature naturally. Now, when this happens in your house, odds are you've reached for the phone, you've hopped online, you've tried to schedule a visit with your pediatrician. In fact, fevers account for approximately 1/3 of all pediatrician visits in the US. Now, when you look at the studies and the surveys a little more, the kind of alarming fact is that 1 in 3 parents reported administering a fever reducing medication for temperatures actually below 100.4, which isn't even technically a fever yet. And if this has happened in your case, there's no criticism or like pointing fingers here. It's simply a fact that there's a lot of miscommunication when it comes to fevers. Because when your body starts to raise that temperature, what it's doing now is using the fever to start to activate immune system function. Research shows that when a fever is happening, there is actually the white blood cells start to increase in circulation. So it's kind of like at the fire department. My son loves any book about fire departments right now. And if there is a fire, the alarm bell sounds and it wakes everyone up. If it's in the middle of the night and the firefighters are sleeping, they need to be woken up first to be activated to go fight things off. So, one thing the fever does is for your child's body starts to activate their immune system. It starts to signal a cascade of neurochemicals and neurotransmitters to say, hey, something's going on. Everyone wake up. We've got some fighting to do. The other thing the fever does, aside from activating your immune system, increasing your white blood cells, is it purposefully shifts your body's temperature to a higher degree than normal to slow down the bug from replicating and multiplying. You see, a lot of the bugs that choose to invade our bodies do so because our body is the perfect temperature to thrive and to replicate. So if we leave our body temperature perfectly normal, that bug says, sweet, that's why I invaded you in the first place. You're at the perfect temperature for me to multiply and replicate, so it's going to be easier for me to start to take over. What happens then is when we raise our temperature with our fever, our body is smart enough to know, do we need 100.5? Do we need 101, 102, whatever it might be, in order to slow down that bug's ability to multiply? And this is why, if a fever gets reduced right away, that it increases the likelihood that it's going to last longer. Because now we drop our body temperature back to a temp that the bug can replicate and multiply. And when we talk to a lot of parents, I know as a parent myself, one of the things we want so often is for our kiddos to feel good, right? We don't like to see them in pain or discomfort. And so when our child has a fever, it obviously doesn't feel good. You can tell they're uncomfortable. You can feel the heat. You can see just like maybe the lethargy in their body, where normally they're used to jumping and running around, and you can just see they're tanked and they're wiped out. And we want them to feel good as quickly as possible. And while a fever reducing med might take the edge off and make them temporarily feel better, what it can do then is prolong how long the virus sticks. So in our office, a lot of times what we see is if a kiddo spikes a real intense fever right away, it also is more likely to come down more quickly and get them to the other side of things much easier. So as we go through this cycle of immune response, I want to finish this up and then go over what are some of the things that can throw your child's immune system off track, and then more importantly, when do fevers warrant medical attention and how to support it without suppressing it. So, if your child is allowed to express things, now it starts to take the immune system all the way to resolution. And more importantly, for long term health, is this full blown immunity. So, if we can get to the other side of fighting something off, we make antibodies. Sometimes you'll notice a child is having a skin rash, or they're sweating things out, they're pooping things out, they're throwing things up, they're getting it out of the body. Especially like a skin rash near the end of an immune response is a perfectly normal reaction to get to the other side of things. So the goal for long-term immunity is to allow your child's immune system to go through this cycle naturally. It's just like learning a new sport or learning how to play an instrument. If all you do is get to first base every time you play baseball, but you never get around to home plate, you're never actually scoring a run and helping your team out. So if every time your kid gets to first, you pull them off the field, they never actually learn how to get to second to third and back to home to really create a complete help with your sports team. So the immune system is just like muscles in the body. When it has a chance to practice, it can go through a complete response to get to the other side of it. If it fights something off on its own, now it's set up for success the next time that thing comes at them. They say, I got this. I've seen it before. So, if you find your child isn't having a good immune response, we want to be able to support that naturally. Some of the things that we see in our office for kiddos that are chronically sick or always getting the same type of thing, whether it's an ear infection or a cold or a flu or RSV, bronchitis, pneumonia, if there's a recurring illness pattern, we often see that their immune system isn't set up to go through that full cycle in order to learn. So, what might be throwing a kiddo off are things that are sticking their nervous system in a chronic stress state. So very early on, it might have been a stressful pregnancy, difficult labor and delivery, induction, C-section, forceps, vacuum. Those things can throw off a child's nervous system early on, especially the upper neck where the vagus nerve lies. That's one of the most critical nerves to help the immune system and get a child's immune system building up naturally. If a child is stuck in stress mode, over time it starts to deplete their immune system. Specifically, when it comes to fevers, you might know your child's immune system isn't working the way it should if you get one of the two extremes. Either one, their fevers are always really, really high, and it never seems like they go anywhere. They just have a high fever, but it doesn't clear anything out. Or on the flip side, maybe their immune system is just kind of giving this a little bit of a response. It never actually ramps up a normal fever, and it just stays stuck at kind of low. And as a result, you sort of see this like always sick, never really clearing things out, or they kind of get through something and then another thing pops up. So those would be signs that you want to look for to support your kiddo on an ongoing basis. When it comes then to when do fevers warrant medical attention, I will share a few points here. I've got some notes on my screen. But one of the things before we go into this that I really want to emphasize is this is such an individual situation. Just like any practice member that we see in our office, anyone coming in as a new patient, we're not just putting them in a category and lumping them in with everyone else. We're taking a very detailed individual history. We're seeing what their neurological scans show up. We're giving them a very specific, precise, unique neurological adjustment, unique to their body, their situation, their circumstance, every single time they come in. So the same goes for your kiddo. Your kiddo is a unique human being. They've had a unique set of life circumstances. And as the parent, you're the one that knows them best. So not only do you know what they've been through, but in that moment, you probably have your gut intuition telling you, is something more severe going on, or can I let it ride? So if your traditional medical provider is more one size fits all and just says, tell me the fever number, okay, reduce it or not reduce it, that can be a little generic for an individual child's unique body. So please know that aside from a neurologically based chiropractor, there's other people out there and providers. And maybe you have an amazing pediatrician that every time sits down with you, tell me what's going on, give me all the details, let me know your child's history. And they have all the nuances leading up to that point to make a good decision. Maybe you have a functional medicine provider, holistic provider, naturopath. A lot of those doctors too can help support your child get through things naturally. So with that disclaimer, here are a few things. Obviously, if a child's very young, if they're under 3 months, any fever is concerning. If they're 3 to 6 months and their fever is getting above 102.2, that's a sign that we want to look into things more. Because ultimately, the younger a child is, the less history we have of how their immune system normally responds and how good they are at getting through things. So a fever in that first 0 to 6 months, you just really want to pay close attention to. Once we start to get over 6 months, now a lot of what we're looking for is uniquely, how is your child responding? And here's where that parental gut really comes into play. Are they really lethargic? Are they having difficulty breathing? Is their heart rate really rapid? Do they have a severe headache, neck stiffness? Are they refusing to drink or hydrate? Do they have a rash that's just like come out really intense and it's not going anywhere? Those would be signs that you want to get some additional support for your kiddo. And one of the things that I want to emphasize is that, again, these are not just like blanket statements, but you really want to individualize your child's care. So especially if they're not drinking, that's one of the biggest things that we see is going to lead to dehydration, can lead to some other issues. So if you feel that, yeah, I want to bring them in and get them checked out, one of the important things to recognize too is that even if you're bringing them in, it doesn't mean medical intervention is necessary, because it doesn't negate the fact that the fever is still beneficial. Maybe they just need an IV and they get rehydrated and now their body keeps that momentum going. The last piece here I want to share is ways to support your child without suppressing the fever. But before I do, I want to just bring up a handout here that a lot of times parents wonder, and we'll put a link in the description, since I know on your screen the text is probably going to be too small to read. But it basically has 6 fever facts and fever myths. And this handout is put together by information from Dr. Barton Schmidt. He is medical director of Children's Hospital in Colorado. He's a professor of pediatrics there. And then also Seattle Children's Hospital has a big input into this handout. So if you go to seattlechildrens.org, you can read about fever myths as well. But basically, it talks about here that myth 1, all fevers are bad for children, especially dangerous above 104. And it says that simply isn't true. Myth 2, seizures with fever are harmful. It says fevers are scary to watch. Of course, we don't want our children going through a febrile seizure. But it says here it does not cause any permanent harm, increase the risk for speech delays, learning problems, or future seizures. So not that we're trying to push our child into this, but to know that it's not like this, if it happens, it's the end of the world. Myth 3, without treatment, fevers will keep going higher. That simply isn't true, because your child's body is smart enough to know when the job is done to bring things back down. With treatment, fevers should come down to normal. Sometimes you might treat a fever and it still stays high because your body or your child's body is working that strong to maintain it. Knowing your child's individual temperature is very important. And if the fever is high, the cause is serious. That's the last one here. That is a myth, that just because your child has a high fever, it doesn't mean that their illness is really high in scariness or intensity. It simply might be that that's what their body needs in that moment to help things out. So, as I said, I'll put a link to give you resources to look at that handout more specifically. But as we wrap up this video, which I know is a little bit longer video because I wanted to give you enough detail to start to empower you as a parent to make better choices for your child, and know that when their body's working hard, it's not just a random reason that we need to suppress all the symptoms right away. So the last piece then is how to support your child's fever without suppressing it. And here are things you've heard about as a parent, but so often we get worried and we get concerned and we kind of overlook the basics. So obviously hydration is number 1. Bringing your child just regular water. Try not to have it super cold, even if they feel hot, because room temperature water absorbs much more easily. And bringing some electrolytes into that water. In our house, we just off of Amazon, it's called Trace Minerals. It comes in a little blue bottle. We get that and we put some drops of water into our water on a regular basis, but especially if our kiddo is sick, we want to make sure he's getting enough minerals and electrolytes. The thing there is just trying to avoid something that has a lot of artificial chemicals or flavors or additives in it. Once you're making sure your child's getting regular hydration, is really setting their room up or their healing environment up for success. Trying to decrease stimulation, low lights, low sounds, gentle, slow, rhythmic movements, anything that helps their nervous system slow down and go into healing mode. Having maybe a few blankets that are kind of light so they can take layers on or off and adjust their temperature how they want to. If they need a bath, trying to do so with lukewarm water, not trying to cool them off, because if you put them in a really cold bath, it's going to drop their temperature temporarily, but their body's inborn intelligence is just going to want to ramp it back up to where it was bringing it before. And then last of all, what we always emphasize with families in our office is get checked by your neurologically based chiropractor more frequent. If your child's fighting an illness, what we find are adjustments help them do what they need to do and get through it much more quickly. So if you feel like your child's stuck and needing some support, that's where it's great to get checked by your neurological based chiropractor. All right, parents. So as we wrap this up, please know that your child's body is incredibly intelligent. And when it's given the resources to do what it's designed to do, when it can go through that whole cycle of the immune response, when it can take care of things on its own, not only might you get through something a little more quickly and not drag it on, but more importantly, that short-term uncomfortability is like a really intense workout. It doesn't always feel good in the moment, but in the long term, it's building your child's body up to be strong and healthy and resilient. So if you have any questions, reach out, check out the links as I said, and know that we're here to help your child have as healthy and strong and robust immune system as possible.